My name is Practicum. I'm a student occupational therapy assistant. We're doing the feeding and oral motor preparatory techniques. And I'll be doing the front hold. So this is my client. He has both his feet on the ground. He's in 90, 90, 90, and his hands are already at midline, so I did not need to move him at all. We're going to make sure that he has good posture. The chair is pretty high back. It does lean backwards a little bit. We wouldn't want it to lean more than it already is in this type of chair. And we're going to make sure that his chin is tucked just slightly, because that opens up your esophagus so when the food can go down completely. For this hold, I'm going to hold my fingers like a peace sign. I'll be stabilizing his chin on the bone so I don't choke him, and this middle finger is going to be on his jawbone on the other side with my thumb below his lower lip so I can kind of control his mouth. And then I can come in. Okay, this is my client. They have hypotone, so we need to kind of wake up the face muscles more so that they're prepared to eat. So this Pikachu, we're gonna do little exercises to stretch, just like quick ones. Kind of wakes it up more. So all around the mouth and up toward the ears. And then we can play a little game with Pikachu, like the Itsy Bitsy Spider, and you're still using your quick finger method. So I'd say like Itsy Bitsy Spider up on both sides of your mouth. That way they're more aware of what's going to be happening. Doing the feeding and oral motor intervention techniques, Practicum. So this is my client. He has a bite reflex. So something we can do is we can just rest this with his hands at midline. He still has his feet on the ground, his legs at 90-90, and his chin is still tucked slightly to open your esophagus. We want to desensitize his tongue. That way he might bite down on it, but we're just going to put the... Go ahead and open your mouth. Can you open your mouth up? Can you put your tongue down? We're just going to leave this spoon in there to desensitize his tongue for a little bit. And the other thing we can do is if he does bite down, I'll show this on Pikachu, and he doesn't let go, we can push just slightly up on the chin for seconds, 1, 2, 3, and let it go suddenly. And that kind of forces the client to let go of the spoon, to open his mouth a little bit, because you're tightening it and then doing a sudden relaxation. Alright, this is the Wilbarger brushing protocol. This is helpful for children with sensory processing disorder because they'll receive a sensation and then they might not process it the same way. So something they touch might be more painful, more traumatic than just in a normal stimulus. Like the clothes you wear could be a lot more dramatic depending on the fabric for them. So this is going to teach them how to process their information. This whole time we're giving them sensory input, and that's going to their central nervous system and teaching them how to respond so that they don't overreact, and it's also getting them used to the sensation so that when something like a different clothing does touch their skin, they are already prepared for it. Okay. So this is going to be my mock brush. I'm going to hold it horizontally so that he has more contact with the bristles. And I'll test it on myself to make sure it doesn't hurt, make sure it's not broken. Okay. I'm going to hold his wrist firmly in one hand, and we're going to do just up and down strokes. If it tickles, then I'm not doing it hard enough. And I don't want to take the brush off, so I'll just switch it like that. Make sure I don't go into his armpit at all. Sorry if that tickled. So we're going to do that on the whole body, avoiding sensitive areas. The armpit is one I said, the groin area, we're going to start from, I started with this right arm, so I'll go from right to back to left arm, and then same with the right leg, left leg, so that we have a pattern. Okay, and then the joint compressions. I want to stabilize both joints and just do quick, I'll do 10 of them. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Move up to the next joint. 2, 4, 5, 6, 7, 9, 10. Do you want to sit down real quick, please? I don't want to injure his shoulder, so I don't want to pull it too high because I don't want it to pop out of the joint. And I'm going to stabilize it still on both sides. 1, 2, 3, 4, 5, 6, 7, 9, 10. And once we do that in the same pattern as before, I'm going to give him those 2 exercises. And today I decided he can make the bed, putting all the pillows and organizing them, and then we're going to put our jackets on and take the dog on a walk. And that is the wheelbarrow.